Hey guys, how's it going? So Dr. Julian here. So I specialize in orthodontics, and some of the questions that you guys ask me, it's not really the scope of my practice. So I invited Dr. Han again. So Dr. Han, he focuses on surgical aspects of dentistry, and today our topic is gum graft. So I don't know, maybe for some people it's sort of like, what is a gum graft, right? But you know what gum is, and you know what graft is. So basically gum graft is when you are lacking gum, then you can actually beef it up by doing some graft. People really wonder what the process actually entails, but having recession, which is loss of gum, is quite common. And especially after orthodontic treatment, it is actually one of the side effects that could happen, especially if you already have pre-existing bone loss or periodontal disease or gum disease. So I thought it'd be a good topic that we discuss with Dr. Han. Can you explain to us, in layman terms, for our viewers, what a gum graft is?
Yeah, so a gum graft is targeted for people who would be lacking quantity of gum, which is gum recession, or it could also be done in patients that have poor quality of gum as well. When you have gum recession, we can do a gum graft procedure to grow the gum back up to cover up the exposed root surface. If you have a poor quality of the gum tissue, then we can improve the quality of the gum tissue also by doing the gum graft procedure. So it's a procedure, it can be done using different materials. One option of using gum from your own palate, or you can also use an animal product, or you can also use a product that's skin donated by another person. Essentially, those all three help to improve that quantity and the quality of gum tissue.
Yeah, he explained the difference about the quantity and quality. So I guess because I see a lot of braces patients, and now I see a lot more adult patients. I would say actually almost half of my patients are adult patients, and they often have recession. And one of the common questions that I get asked is, should I do a gum graft before I do orthodontics, or should I do it after? And I actually wanted to hear your opinion of what you say. Yeah.
Every patient have different gum types, and that is why the initial assessment of the patient is important. Some patients have a thick gum type, especially female patients. They have a paper-thin gum type where you can actually see through the root underneath it. So best time to do a gum graft, in my opinion, is after the braces is complete. So, because in younger patients, you can have gum recession due to poor alignment of the tooth. So if the teeth are very crowded, they're very, one tooth is a lot more forward than others, then that could be the reason for gum recession. By doing braces, you can correct the gum recession just by doing the braces alone. And in that case, you don't need gum graft.
Right.
And also in cases where you do have very thin gum and you already have a pre-existing gum recession in adult patients, sometimes putting the teeth into a better position can sometimes improve the gum recession without doing the gum graft. So I would prefer to see the orthodontic outcome first before deciding whether the gum graft is needed or not. But I'd like to hear your perspective as well.
Right. So that's actually how I tell my patients, is that oftentimes in kids, when we see localized gum loss, it can actually grow back, it can rebound after we align the teeth. Because first of all, they have a very good healing capacity. And second of all, that status or that recession hasn't been there for like a super long time. So once the teeth is sort of moved back into bone, the gum can actually regrow, rebound. And in adult cases too, I've seen cases where the teeth are very out of whack, and that's why you get those gum recession. Because you can imagine, if the tooth is out here, your gum's gonna sort of slide down, it's gonna thin out, right? So, but imagine if we create room and then we bring it back, then the gums can actually rebound even in adults. So that's how I usually tell my patients too. So I'm glad that we're on the same page. But that being said, like if there's like severe bone loss or severe gum loss, and you know, you could see big black triangles already present, and if we were to move just a tiny bit with braces, the tooth is just gonna fall out probably. I would refer to you to get an opinion first before they embark on the orthodontic journey, because it could be a contraindication to braces. So what about like, can you tell us about the two main types of grafts, like the free gingival graft, the connective tissue graft? Like,
Yeah. So there are two different types of gum graft. One is called free gingival graft, or we shorten it as FGG, or a connective tissue graft, also shortened as CTG. So essentially, it refers to the cases where we obtain tissue from your own palate. Free gingival graft is mainly targeted towards patients who have a poor quality of gum tissue, and we want to improve the quality of the gum tissue. It's quite often used on lower anterior teeth because that's where the tissue tends to be very thin. But by obtaining a free gingival graft, we can thicken it, make the gum quality a lot more resilient against further recession. Whereas a connective tissue graft is used in cases where we want to improve the volume of the gum, or if we do want to cover up the gum recession. It can produce an aesthetic outcome compared to a free gingival graft, but both serve a different purpose.
Yes.
And whether we go with free gingival graft or connective tissue graft, that's at the discretion of a dentist. What is the difference between free gingival graft and connective tissue graft? It's the same tissue from the palate. Free gingival graft, we use the outer skin layer of your palate, whereas a connective tissue graft is a tissue that we obtain on the inner part of the palate, leaving the outer skin behind.
I see. So we still harvest it from the roof of the mouth, the palate, the roof of the mouth, but I guess the aspects, or like which parts we use is different, right? So what about, let's take like a real life scenario where adult patient has black triangles, or if they have like these visible gaps in between the lower incisors, would that be better to do free gingival graft in that case? Or
if the patient has a black triangle and there's no what we call papilla, which is the gum tissue in between the teeth, then trying to cover up the recession in those cases become extremely difficult because the bone level is low, the gum level is low with a black triangle. So trying to achieve a gum recession in those cases become unpredictable.
I see.
And therefore, free gingival graft would be a preferred option over a connective tissue graft. On the other hand, if patients have quite a severe gum recession on the upper front teeth, and there's no interdental papilla loss or no black triangle, then a connective tissue graft would be a better option because it would be more aesthetic pleasing. The color of the gum tissue merges in with an existing gum tissue compared to a free gingival graft where the color of the outer skin layer of your palate would be visible.
Right. Yeah. So because the lower teeth we don't really see as much, so it's not as big of a deal to have a different mismatch in the skin color as opposed to on the top, because when we smile we mostly show the upper teeth and the gums, so we want that aesthetic result, right? Yeah. So can you briefly now explain about like the process of doing a graft?
Essentially remove a superficial layer of your gum on the, for example, if you're working on the lower front teeth, we remove the superficial layer of the gum, and then we obtain the outer skin layer from your upper palate, and the thickness is usually about 1.5 millimeters in thickness, and then we would then bring it to the lower front side where you have an exposure of the gum, and we would put stitches over it to secure the graft, and we would then wait for about 2 weeks to remove the stitches.
Okay. So It takes about 2 weeks for you to remove the stitches. Is it like really painful? Do patients report a lot of pain in the first few days, or?
For patients who undergo connective tissue graft or FGGwa graft from your palate, the main discomfort is mainly from your palate.
Right, where it was taken from.
Exactly.
It's a void now.
Exactly.
Yes.
As opposed to the actual recipient side, or where you have areas where you have gum recession. So we would often put a layer of collagen sponge over the palate, or we sometimes make a clear, like a Essex retainer that covers the palate to reduce the patient discomfort. And that's why we do also have option of using products such as annual product or human product in connective tissue graft cases to reduce patients' discomfort.
I see.
That comes from the palate.
But the success rate would be best if you use your own tissue, right?
Yes,
Is that right?
the acceptance would be better with your own tissue than with an alternate product.
And then what about, let's say, during the time that you're healing, what should you avoid? What are some of the post-op cautions you should take?
It's with any surgeries. We don't recommend spicy, hot food just because it's going to hurt the palate a bit. No smoking, no alcohol, no drinking from a straw.
What about vaping? A lot of patients ask.
Vaping also, we don't recommend vaping just because that whole drawing in
the suction.
The suction, yes.
Using like a straw is also not recommended for that reason too, right?
And yes, exactly, because that will, one, cause blood clot to fall out and induce new bleeding. So the bleeding's not going to stop well, and also it's going to impede on healing as well.
I know our PD Sim used the straw right after her wisdom tooth surgery, and it started to bleed, right? Yeah. But
I mean, as you're well aware, despite us doing our best in giving those precautionary post-operative instructions,
they don't listen.
Unfortunately, they don't listen. You know, we quite often say no smoking.
No smoking
for about a week.
No drinking.
Yes, and I see patient leaving the door and straight up smoking. So please follow our instruction. That will improve the success rate of the surgery.
Yeah, I don't blame you, but I mean, you know, it'd be nicer if you listen to us and you get better results, right?
Exactly.
So, yeah, so I mean, we briefly talked about what graft is and sort of the indications and what to expect for the surgery and the healing. I know Dr. Han brought us some oranges, and that's not for us to eat, but he's going to demonstrate how the surgery would sort of take place, but using the orange, right?
Yes.
Yeah, so we'll go there in a bit. So basically, the graft is recommended for patients who do have recession, but it's not, I guess, it's not magic, right? Like you cannot, if you have big spaces, you have big bone loss, you cannot like regrow gum up to where it used to be when you're in your teens and things like that. And you have to set your realistic expectations, but if we select the right cases, then the benefits are great, right? You can reduce the sensitivity, you can improve the aesthetics of it, you know, you can cover up your roots better, the spaces better, and things like that. So, but yeah, I thought it was very helpful just to go over, and I hope you guys feel the same. But if you have any other questions to ask, feel free to drop them down in the comment section below. And yeah, we'll see you guys next time.
Hi, Mr. Mandarin. I'm gonna show you how we harvest the tissue and what the difference between a free gingival graft and a connective tissue graft is. Free gingival graft is where we obtain an outer layer of the skin from your palate, whereas the connective tissue graft is where we obtain the inner layer from the palate. I'm gonna demonstrate start off by demonstrating what a free gingival graft procedure is like. So we make a small incision on the palate. And prior to harvesting a tissue, we use a template to accurately measure what the size of the graft is going to be like. So we would first mark the size of the graft, and then we make a superficial cut around the graft until we have the outer skin layer, which will then be secured with the suture or the stitches over the areas with poor quality of gum. So this is what a free gingival graft harvesting is like. So next I'll go into a connective tissue graft, which I'll demonstrate on the other side of the mandarin. So same thing, we mark start with an incision. And we also make a superficial cut. And I'm just going to lift this up just for your perspective, just to make it easier for you to see. Once we detach the outer skin, then we make another cut. And it's not easy with a mandarin, unfortunately, because oranges have thicker skin than mandarin, but I'll try my best. And then this is the inner part of the palate called connective tissue graft, leaving behind the outer skin of the mandarin, which will then be closed up. So this inner part of the skin will then be transferred over to areas with gum recession to grow the gum back. So if you look at the two side by side, the free gingival graft, we utilize the outer skin, whereas a connective tissue graft uses the inner layer of the skin.